Hey team, today we're going to talk about tendons or tendinopathy, which is an overload of the tendon. The most common types of tendons we'll treat in the clinic is the Achilles, the patella, and this lateral elbow. So a lot of people call this tennis elbow. Common signs of tendon pain, usually it's really localized, so you won't see pain all over the place. It'll be really local pain. Sometimes it's right on the attachment, and then sometimes it's on the muscle belly. The muscle belly pain, or a couple of centimeters from the attachment, usually is a lot quicker to recover than the one exactly on the muscle belly. The tendon pain we'll often see this overload. There's no acute trauma, there's no rugby tackle, there's no fall. It just gradually comes on. It's usually from overuse. Sometimes there's a change in your training load, footwear, sport. There's some common things, or builders, for example, they're doing a lot more lifting than usual. There's some examples. Tendon pain commonly, like when it's cold and you start moving, it's quite painful. So first thing in the morning, if you're walking around for the Achilles, and then it warms up, or if you're warming up in sport, running around, the patella sort of feels a bit sore and stiff, and then it warms up and feels okay. And then you warm down, and afterwards it's really sore. The next day it's really sore. These are really common signs that you've got tendon pain. Some of the do nots. So I would not stretch tendons initially. I think that delays progress from what I've seen in the clinic. I would not be rubbing directly on the tendon, especially where it attaches. I think, again, that delays progress. I haven't seen great results through anti-inflammatory medication or any medication, but for some that may help. Heat and ice, sort of 50-50. If it feels good, use it, would be my comment. Again, that's not going to solve all your problems, maybe some short-term relief. What do I think you should do if you have tendon pain? One is you need to know, is it tendon pain? So if you're not sure, get proper assessment just to confirm that. One of the first things we'd want to do would be to massage the tendon, or use a foam roller or a massage gun on the muscle, not where the pain is, on the muscle, just to free it up. And then strength, you just cannot beat strength. Tendons love being strong, particularly if you've had this pain more than once. Then something in your system needs to get a lot stronger, either on that tendon or throughout that chain that leads to the tendon. So in terms of strength, common mistakes, people they're going up and down doing calf raises, for example. They're off a step too early. So the timing you introduce strength matters. Most of my clients, I'd say 98% of them, are going to be doing static strength to start off. Commonly I'll have people doing like 5 sets of 60 seconds or more on calf raises, and I'll have to choose the height of that calf raise. That depends on where the pain is in their Achilles, for example. Or they're going to do wall sits, or what we call Spanish squats, for the patella tendon. So do holds first is the key. Trying to do dynamic strength when you have tendon pain initially usually makes it worse from what I've seen, but static strength can help alleviate pain. Of course, at the same time, you've got to decrease those activities that cause the pain in the first place. If you've got an event or a sport that you must be participating in, you just got to do some cross training around that whilst you're dealing with the tendon pain. Tendon pains, static strength is key. Once you've got that and you've got some initial relief, you can progress to dynamic strengthening, strengthening with weight, one leg or more loaded strengthening. And you've got to go through the whole strength process. Generally, unfortunately, the whole strength process can take 3 to 12 months. But you can get rid of the pain quite quickly, usually within sort of two to 3 weeks, if you've got the right prescription. So ongoing strengthening is usually required. And those who have kind of sticky tendons where the pain comes back, I'll commonly recommend looking at the broader picture. Might be running technique, might be footwear, orthotics. It might be, what's this in the leg, for example, what's the stability like on one leg, or the glute strength. For Achilles, what's hamstring flexibility like? For up the chain here, what's shoulder strength and stability like? And you'll work on that whole chain of strengthening, which, after good assessment, you can pick up on what specifically needs to be worked on and work on it. Anyway, these are some thoughts on tendons. Hopefully that's helpful. If you need any help, shoot me an email, peter@peterhphysio.nz.